I'm really excited today to introduce Dr. Winterberg. She's a practicing pediatric nephrologist and researcher for 10 years before joining Alexion, AstraZeneca's rare disease in 2022. As Senior Medical Director in Clinical Development, she is dedicating to finding new treatment options for people living with kidney disease by designing and running clinical trials. And she's going to talk to us a little bit about some of the innovation and how Jessie was able to be transplanted and what's the next step for studies. So with that, thank you very much, Dr. Winterberg, for joining us today.
Thank you. Can you see the slides? Is everything working?
We can.
Okay, perfect. Well, thank you again for the introduction. The medicines that Jessie was talking about that treat her atypical hemolytic uremic syndrome, or HUS, block a part of our immune system called the complement system. And those medicines have now been approved for treating several other either rare or debilitating diseases that are due to complement.
Got 7 minutes on that.
But today I wanted to share a new study that we're looking at using the same medicine in patients living with chronic kidney disease who are at risk for acute kidney injury when they have heart surgery. And so that's really the main focus of today. Although there are many other exciting programs at Alexion as well for other kidney diseases. So what is acute kidney injury? This is a short-term or a very sudden decrease in kidney function. It usually occurs over hours to days, and it's due to some kind of injury or damage to the kidney cells themselves. The signs and symptoms include a change in the blood creatinine. I think this audience understands that pretty well. The creatinine goes up in the short term, so a very sudden increase in the creatinine. Sometimes you can have a decrease in the amount of urine that is made as well, but not always. And then when the kidneys aren't working, all the functions that it normally does to keep the body in balance can get out of whack. And some examples are there can be changes in the blood acid levels or some of the salts or electrolytes, some of which can be dangerous, especially after heart surgery, like potassium. It's very important for your heart. And then finally, if the amount of urine coming out isn't meeting all the fluids going in, especially in a patient that's in the hospital after a surgery, you get swollen in the body as well. That can be in your arms or legs. It can also be fluid around or inside the lungs or around the heart. So what causes AKI? In general, the injury to the kidney cells are in two big buckets. It's either a whole bunch of different conditions that cause a decreased amount of blood flow to the kidneys, so the kidneys just aren't getting the blood and the oxygen they need to do their jobs. The other is forms of toxin injury to the cells. So that's typically by medications. That can be very important medications like chemotherapy or other commonly used medications like antibiotics. Currently, there's no approved treatment for either preventing AKI or treating it once you have it. It's really about managing all the consequences of the decrease in kidney function in the short term. So some examples of how AKI is managed. Sometimes we can give medications that increase the amount of urine flow, like Lasix. Sure, this audience is familiar with that one. Restricting certain types of nutrition or medicines that build up in the body when your kidney's not filtering as well. Temporarily using dialysis to remove either the excess fluid or some of the electrolytes or other things that build up in the body. Sometimes when there's fluid around or inside the lungs, a patient might need extra help breathing. So they might need to be intubated and on a ventilator if that's the case. Or in the case after a surgery, it takes longer to take out that breathing tube after the surgery. And really, it's all about keeping these complications managed while waiting for the kidneys to heal themselves and seeing how much kidney function returns after the damage is done. So why are we studying AKI during heart surgery? It turns out that certain types of heart surgeries use a pump called the cardiopulmonary bypass machine. And these types of surgeries have very high rates of AKI. So it's a common problem in this patient population. However, we're challenged in that the injury likely occurs during the surgery itself, but it can take several days before we actually can recognize that the AKI has happened. And by then, the injury's already done and could be so extensive that it's hard to treat. So there's been quite a movement to try and find ways to prevent the AKI during the surgery itself, to decrease the number of complications after AKI happens. Or either reduce the AKI altogether, like not happening, or how severe it gets. When you have a heart surgery, the timing of that AKI is better known versus other types of AKI. Like if you have an infection and your blood pressure drops, that's not always as predictable as being scheduled for a surgery. And so this allows time for a treatment or a study medicine to be administered before the injury itself has occurred, and then therefore prevent. So that's one of the reasons we have started looking at this in a heart surgery patient population. So what is this cardiopulmonary bypass machine? It's essentially a heart and lung machine. It takes the blood out of the body, kind of like the dialysis machine, and it pumps it through a big machine that adds oxygen, it removes carbon dioxide, and it pumps it back into the heart, so back on the other side of the heart. And so really, instead of clearing your blood like dialysis, the cardiopulmonary bypass takes over the function of the heart and the lungs together. And this allows the surgeon then to be able to do the surgical procedure on the heart itself. Inflammation is considered one of the multiple types of causes for acute kidney injury. And specifically during heart surgery, it can be a vicious cycle. Being on that cardiopulmonary bypass pump is not normal. Like the amount of blood flowing through your body they do the best to make it keep all your organs happy, but it's not the same as a beating heart. So there can be a decreased amount of blood flow and or oxygen to the kidneys while you're on that pump. And a person who has kidneys that already have chronic kidney disease in them may be a little more sensitive to that type of injury than a person who has healthy kidneys. The kidney damage itself can trigger inflammation. It's like a little alarm that gets sent out by the kidney cells themselves when they're damaged. Similarly, the pump can cause inflammation in the blood vessels all through your body, and there are a lot of blood vessels in your kidneys. And so it becomes another area that the blood vessels also become inflamed, and that can become a vicious cycle to further injure the kidney itself. And then finally, at the end of the surgery, when they stop the pump and they have the heart doing the job again, the kidneys can kind of get shocked again when the blood flow returns back to normal. So all in all, inflammation can be either started or worsened by this complement system. It's a part of that immune system, and that's what we're interested in studying in this clinical trial. So how, in general, do we find new treatments for any disease, but specifically AKI? It's by conducting clinical trials. So a clinical trial is a scientific study designed to answer two main questions. Is a treatment effective, meaning does it work? And is a treatment safe? And many times that can be a balance between the two. The Artemis study is the trial we're talking about today. Is what's called a phase 3 randomized, double-blind, placebo-controlled clinical trial. And it's studying whether blocking complement activity reduces the risk of major adverse kidney events at 90 days after heart surgery in people living with chronic kidney disease. So that was a lot of vocabulary there. So just to orient everybody, what these all mean, a phase 3 trial is the type of study that's required for approval by health authorities, like in the US, it's the FDA, the Food and Drug Administration, in order for a medicine to be sold as a treatment for a specific disease or condition. And it is the most rigorous type of clinical trial. Placebo-controlled means that some participants in the trial will receive active medicine and others received an inactive substance that they typically look the same. You don't know which is which. But it's a way to understand truly the effect of the medicine and not other things going on in the care of a patient, especially with complex medical conditions. Randomized means that each participant's type of treatment, whether they are getting the active medicine or the placebo, is chosen at random. It's by chance. And then finally, double blind means that treatment arm, or which one they get, active versus placebo, nobody in the study knows about which one you got. So the participant patient, the healthcare provider is taking care of them, and even the sponsor or the maker of the medicine during the trial don't know which individuals received the active medicine versus the placebo until the very end. Every patient has finished the trial. Okay. So overview for Artemis. It's again a study in people living with chronic kidney disease and who need a heart surgery. We'll talk a little bit more about specifically who is included in that group. But there's a period where there's an informed consent to participate. We have a visit to understand if a participant is eligible for the trial itself. And then there's a single IV dose of either the placebo or kind of inactive substance, or ravulizumab. That's the cousin to Soliris that Jesse was talking about. So it's a single IV infusion that occurs within about a week before their surgery, so 1 to 7 days before surgery. There are several visits that are primarily dealing with blood draws to understand the kidney function, that occur in part with the ongoing medical care that people receive after their surgeries, as well as a few outpatient visits after they go home from the hospital. But overall, their study visits are concluded after about 90 days following the surgery. The main thing we're looking at, the difference between placebo and ravulizumab, is what's called MAKE, or major adverse kidney events, and that's at the 90-day visit. So let's talk a little bit about what MAKE is. So in order to establish new treatments for AKI, they're tested based on reducing events that occur after AKI. AKI itself is not really something the health authorities see as something that we can treat specifically. So this is just a diagram, again, of the study, adults living with chronic kidney disease, needing heart surgery on that bypass machine. If they have acute kidney injury, there are several things that can happen after that acute kidney injury. And that's not that they're one only. Some patients have multiple of these events that happen. So the acute kidney injury could resolve, or you just don't go back to the baseline kidney function that you had before the surgery. That's what's the bottom of this orange box, decreased kidney function by 25%, seen 3 months later. So you just don't fully recover. You might need dialysis within the short term, sometime in that 90 days. Whether you stay on it or not, that's still considered a major event. Some patients die from their acute kidney injury, either on dialysis or without dialysis. And so any one of those events, either death or dialysis, occurring within the 90 days, or if those haven't occurred and you have decreased kidney function at 90 days, so that's a 25% reduction of your GFR, that would be considered a participant experiencing a major adverse kidney event. And so at the end of the study, we'll be seeing if those MAKE events are reduced in the treatment arm compared to the placebo arm. That would help us understand if it's effective at preventing AKI. Who's included in the study? Again, this is for adults aged 18 through 90 years at the time of consent, who are needing to go for heart surgery, either for coronary artery disease, so that's often what causes heart attacks, or heart valve disease. You need to have chronic kidney disease already with a GFR as a measure of your kidney function between 20 to less than 60 mils per minute, and then have other risk factors that place you at high risk for kidney events after surgery. Who may not be eligible for the study are those who need a heart surgery more emergently, so an emergency heart surgery. If the surgery is going to be performed not on that cardiopulmonary bypass machine, if you needed dialysis before the surgery, within the 30 days before, or you've experienced AKI within those 30 days, because we need to see that your kidney function has gone back down to normal before we try to prevent another AKI. And then patients who already have an organ transplant, including a bone marrow transplant, are currently not eligible for the study. So in summary, AKI during and after heart surgery is caused by a decreased blood flow to the kidneys and inflammation during that cardiopulmonary bypass pump procedure. People living with CKD are at higher risk for major adverse kidney events. That includes death, dialysis, or a sustained decrease in your kidney function after that heart surgery. The Artemis study is evaluating a new treatment to reduce the kidney events after heart surgery in high-risk patients with chronic kidney disease. I listed here just for later if you have other, if you're interested in other information about the Artemis study itself. There are two websites listed here. One is the clinicaltrials.gov, where all clinical trials are supposed to be listed. So thank you again for your attention, and I'm happy to answer questions.
Thank you, Dr. Winterberg. I think it's pretty amazing that there's so many different people studying kidney disease. And what's really ironic is I had the opportunity, Dr. Richard Fine came, I had him and my young pediatric team over for dinner right before COVID started. Mm-hmm. And he was sharing with me, I was his first acute kidney injury patient. And I had kidney failure. Now they really pretty much believe it was hemolytic uremic syndrome due to E. coli bacteria. Yeah. And it was 1968. They didn't know what they were doing. And ironically, or I don't know, sometimes the things that you think kill you end up saving your life. They put me on dialysis with a Scribner shunt, and the machine broke down and I started bleeding. And they transfused me, and 14 hours later, my kidneys started working again. So I really had a plasmapheresis happenstance, that they didn't have plasmapheresis back then, but I did by that blood loss. And it allowed my kidneys to kick enough in where my blood pressure was so high, it never, ever recovered. That's ultimately what took my kidneys out. So acute kidney injury has affected me my entire life, and they believe it was from meat not properly cooked. So I'm on a campaign to let people know the risks. So Thank you very much for your dedication, and pediatric nephrologists, I have a special place in my heart for them because I just grew up. You're like my family. And I invite you to come to the 26th prom. It's in Los Angeles on February 16th. I mean, you will see a lot of kids who are doing well because of we party actually. So I really thank you for your commitment to pediatric nephrology, and I look forward to meeting you one day.